Hallo, Herr Professor Roder, vielen Dank.
Hello, Professor Roder. Thank you for taking the time to answer my questions today.
My pleasure.
My first question would be, how long does a Moyamoya operation take?
We usually need 90 to 120 minutes for a bypass. Since we also operate on 2 bypasses in one session, this of course takes a little longer then. But in itself, the direct STA-MCA bypass for the middle cerebral artery takes 90 to 120 minutes per bypass. Patients then stay one night in the monitoring ward after the operation, and the entire inpatient stay usually lasts around 5 to 6 days.
So it's pretty quick, actually.
Yes.
If I have an operation, what will change for me after the operation?
First of all, you'll feel similar after the operation to how you did before the operation. So you don't have to expect anything to get worse. You also should not expect to feel much better in the short term, because of course you had brain surgery. But usually patients do feel better over time, like a few days to weeks. That means that the bypass will deliver more blood to the brain, it will grow, and it will get bigger and supply the brain with more oxygen. And patients who tell me that they were feeling a little worse before the operation, in terms of tiredness, fatigue, reduced performance, then report at the 3-month checkup that they are more vital, have more energy, and are becoming more efficient.
So that means that I don't see a really big difference before the operation to after the operation, but rather it is more of a gradual progression in the positive direction afterwards?
The donor vessel is very small. It has a diameter of about 1 millimeter, which means that it can only deliver a few milliliters of blood at the beginning, and then it grows over time and delivers more blood accordingly.
Can I pass Moyamoya on to my children?
Well, theoretically it is possible, but it is extremely rare in Europe. The risk of familial disease in Europe is well under 10%. We generally say that if the family history is otherwise unremarkable, that is, if not several of your ancestors have suffered from a cerebral circulation disease, there is generally very little to worry about. And we do not recommend any standard preventive examinations for children. We ask patients to simply pay attention if there is anything unusual about the children. For example, if they have unusually frequent headaches for children, or if they have strange sensory feelings. If they say, "Mommy, my arm tingles all the time," then we would recommend to be a little more generous in the indication for an MRI.
Okay, but that means I don't have to worry?
No, not at all.
If I have an operation, it will be an operation on the head. Will my whole head be shaved, or how exactly should I imagine it?
For the STA-MCA bypass, the bypass that is actually most commonly used for the middle cerebral artery, we are only shaving a very narrow strip of hair. This is in front of the ear, about 7 to 8 centimeters long, and then you won't see anything of it later. The hair will fall over it again, or you'll just see a very slight scar under the hair, especially in men with short hair, but you won't actually see anything of it in the long term.
Can I fly normally again after an operation like this? Some patients also wonder whether they can ride roller coasters.
In the long term, you can do everything again after the operation. The law ultimately stipulates that you should not drive a car for 3 months. That is a legal requirement, but in the long term, you can do everything again. If you say, for example, after 3 months, whether you can ride roller coasters or fly again, I can answer that with a yes. In the medium and long term, you can ultimately do everything you could before the operation. There are actually no restrictions. The bypass is running, then the need for blood will regulate itself as to how much the brain needs, and will then supply more blood for life.
Then, of course, there is another interesting question. Is Moyamoya disease basically curable?
So basically, the disease is not curable. We can neither fix the narrowing of the brain artery, nor can we eliminate these collateral circulations. What we can do, however, is to bring more blood to the brain through the bypass operation, and thus ensure a permanent blood supply, so that you do not have an increased risk of stroke for life, and can therefore have a completely normal life.
Okay then, we come to the last question. I would be interested to know how you came to have such a rare disease like Moyamoya as your clinical specialty.
Well, it actually started when I was at med school, and it was by chance that I first came into contact with Moyamoya patients as part of my doctoral thesis, and I also met Professor Kahn, who had already established her center in Zurich for the treatment of children with Moyamoya. In 2012, we decided that we wanted to set up a Moyamoya center for adults in Tübingen. Ultimately, with the support of Professor Kahn, we were able to pool this expertise here in Tübingen. And by passing on knowledge, we were able to build up the center over the years. So with the support of many colleagues from other disciplines, we were able to further expand our knowledge here and thus also managed to establish a research focus here.
Great! Thank you very much for your time. It was very interesting.
Thank you very much.